We'll deal with it.
Patients are not put to sleep for LASIK surgery.
We need them to fixate on the fixation light so that the laser can fire. And we do have a tracking system for the laser, but if the eyes couldn't look up at the laser, there's only so far the laser would track. So there's numbing medication topically placed in the eye a couple of times. And we put sterile drapes on the eye to keep our field clean. And then place the speculum to hold the eye open.
After the speculum, Dr. Vail marks the eye, which helps him locate the astigmatic axis in patients having an astigmatism corrected. The marker also helps Dr. Vail realign the flap that he's about to cut.
A LASIK flap is a piece of stromal tissue that we cut from the cornea but leave attached by a small hinge. So you do the treatment inside and then put this piece of tissue back over.
To cut the flap, Dr. Vail has to secure the eye with a suction ring.
Once Kathy activates the vacuum, the ring holds the eye and firms it up. And then a second instrument called a microkeratome comes across the eye and cuts a thin layer of, like the thickness of a contact lens. No squeeze. So really what you're doing is you're doing two procedures. One, cutting a flap, and the other one, performing ablation of tissue with a laser. Some lasers are thermal, where they actually create a sizzling or burning effect. Other lasers are disruptive, where they actually create like a shock wave. This laser actually ablates the molecules. It takes the molecules and breaks them apart into carbon.